Hello and welcome to the Health Center with Ozion at Kunye. And here's your regular host and anchor, Ozion the Expressionist. Today's topic is rheumatoid arthritis. Yes, as requested. Rheumatoid arthritis is that we call rheumatism. Rheumatism is rheumatoid arthritis. Okay, rheumatoid arthritis is an autoimmune disease. It's not the disease you see as just pain in the leg. No, it is a disease that manifests by pain in both sides of the body wherever it's attacking. Especially if it's attacking you at the hand, this hand will be you'll be feeling pain, swelling, redness, stiffness on this joint because it attacks the joint. The synovial area is what it attacks, and it will be happening here as well. The same symptom here, the same symptom here. Why does this happen? It is an autoimmune disease. An autoimmune disease means a disease whereby your body system, your immune system, attacks your cell. This is different from when we discussed allergy. Allergy is your body immune system attacks a certain allergen by reacting inflammatory response towards a certain allergen. Here, there is no specificity of an outsider. It rather attacks you. The cell, the healthy cells in your body is being attacked. There is no harm this joint, the synovial fluid, or anything about this has done to the immune system. No. But it is you that have disrupted something in your immune system that now makes it to be fighting somewhere else. How did you contribute? It does not mean that you cause yourself this autoimmune disease, for instance, the rheumatoid arthritis. No, but you can endanger yourself to be having it because there are certain factors, risk factors that could make someone to have rheumatoid arthritis. Rheumatoid arthritis is just one of the autoimmune diseases. There are several autoimmune diseases, even hyperthyroidism, there is lupus, there is even your type 1 diabetes is an autoimmune disease, but that attacks specifically the cell that does not do anything to it, the beta cells that produces insulin. But this time we are discussing the rheumatoid arthritis. It attacks the joints, and as well, it doesn't end there. It also attacks several other areas of the body, the heart, the eyes, the skin, and several other areas listed here. That's why autoimmune disease of the rheumatoid arthritis is not something that you see from the surface. It goes deeper than what we see outside. So this rheumatoid arthritis is more in women, far more in women than in men, and it is affects most women who are, as you age, the effect keeps manifesting and becoming more pronounced, as well as those who have not given birth before. Because those who have given birth and have had been able to breastfeed has uh, propensity and uh, reduced propensity of having this disease. So there are other factors like obesity. If you're obese, and that's why a woman, it is a factor as well. And whether a woman or not, consider these factors as factors that might cause you this kind of disease we are talking about now. Smoking, one very big factor. Whether you're smoking before you give birth, if you're smoking before you give birth as a woman, your child is in danger of suffering from this. And if you have given birth and you're still smoking, that child that is receiving this smoke is having the kind of is having some factors that will put him to suffering this disease in future. So we have to really be very careful with the lifestyles we live to avoid putting the next generation into trouble. While this smoking can exacerbate your condition of rheumatoid arthritis, it will equally affect that child very dangerously. So, how do you manage this disease that gives you this symptom? And what's the symptom? The symptom is typically pain, swelling, redness, stiffness, fatigue, loss of weight. So these symptoms mentioned and as you see on the screen are very, very much pronounced in one having this disease, rheumatoid arthritis. And you have to manage this by exercising, hot or cold compresses therapy, and as well as the treatment, the medications you need to give to this person. Some medications have been used in the past and present, but if you know the right medication, it will really help me from not having some exacerbations or other complications. For instance, the corticosteroids have been used over the years, but have been found as a medication that is its side effect is becoming more worrisome, giving you obesity as well as raising your sugar and as well as causing you more infections, and equally causes the bone to be more brittle. So by that, research has proven that that drug is not more beneficial anymore. So they have changed to methotrexate and as well as the DMARD. The DMARD is the drug modulating anti-rheumatic the anti-rheumatic drugs, the disease modulating anti-rheumatic drugs. So and some other medications recently have been proven to be better than corticosteroids. So as much as that still treats, the side effect is something that is not very good to be sustained. This disease can cause you heart problems. Yes, it has a very that has been recognized as one of the very big problem someone who suffers from rheumatoid arthritis could suffer. Heart problem. So it goes a long way because what happens is that your microbiome, your system here, our stomach area, digestive and intestinal system, contains these healthy bacteria. We've talked about it in the past, but here to let you know that the microorganisms here that are healthy helps in building our immunity because they fight against certain kind of things that we eat. But now, when you deplete this micro biome, what happens is that your your immune system will go to fight your healthy cells, begin to fight your cells erratically. The management, it doesn't have control. So which cell is it fighting? That's a problem. It fights erratically, and most times the cells it fights in this particular condition affects your, depending on where your own pre-existing risk factor. And in this case, it is rheumatoid arthritis because there are other autoimmune diseases like the lupus, like the thyroid, hyperthyroid, and other diseases. So this particular one will fight you that it will begin to present as a uh, autoimmune, right, thyroid, and what you call it, the rheumatoid arthritis, which presents with all these symptoms that I've mentioned. So the problem now is you need to know how to manage, like I've listed, and then you need to avoid certain kind of food you eat and equally reduce. Sugar has been found guilty of depleting this microbiome. So the especially processed sugar, trans fats, certain foods that have been found as unhealthy, bad fats, those go into the microbiome and destroy them. And when they destroy them, your body will begin to misbehave, right? Become erratic and become aggressive in its response. And that is the autoimmune condition. Not the autoimmune is not does not exist in everybody, but there are certain level of stressors you would introduce into your body, neurotoxins and activities, and your body will begin to misbehave, and the results will not be very good for you as an individual. I will end this here and expect more questions on the comment section as usual, and I will attend to it. And I hope that you'll keep yourself fit by following Kunye and inviting more people. Remember our exercise sessions always. Join us. Stay healthy, for we always have the slogan, health is wealth, and we mean it. Thank you very much for watching our program today, and remain safe.